We had a day this week where we had more than 5,000 cases. I think yesterday we were 2,500. I haven't looked at the official number, but that's a pretty big spike. And our problem is it's in people who are unvaccinated for the most part.
For the most part, correct.
And what demographic are those? Are they older people? Are they younger people? Or is this one all over the board?
So it's all over the board. By far, the majority of people vaccinated are over 50. So the majority of people we're seeing getting sick right now, of course, are going to be, teenagers to 49. But so, the docs are telling you, you've heard them on the governor's speech. You heard that lady speak so eloquently. They're seeing people their age, in their 30s, in their 40s, in the hospital, sick and struggling to breathe.
Young people are getting sick with this variant, not unlike before if young people got it before, they were okay.
Well, let's define.
Stay home for your 14 days.
Young people.
Under 40.
Are 12-year-olds getting sick? Are 22-year-olds getting sick? Or is it 25 to 34? Explain to us.
So I do have a newborn on the vent.
Wow.
Who got COVID from his mother. That's the first time we've seen that in this area.
Born with it.
Born with it.
Wow.
So we are seeing some children sick. Of course, by far the larger number is in adults.
Breakthrough cases, very few in the big scheme of things, correct?
Define that for everybody first.
Yeah.
So when we look at the numbers, I believe the last thing I saw was 93% of people who are sick are unvaccinated. So about 7%
That's
of
what
people.
breakthrough case means.
So if you got vaccinated and you got sick, now by the far majority of them, like 99.1% of people who are vaccinated will not end up in the hospital and will not die from COVID. There, of course, if you're in that 0.9%,
it's critical to you. Can someone who is vaccinated be walking around with this Delta variant, not get sick because they've been vaccinated, but pass it to someone else?
Yes.
And are you seeing that?
Are the rules the same? Because always before was the reason the status quo has been, if you've been vaccinated,
take your mask off.
But you get COVID, but you're still not going to be terribly contagious because you're not going to be coughing and spitting and sputuming and whatever it happens to be. Has that rule changed?
So the reason why we said you could take your mask off with the Alpha variant was because you really didn't carry much of a viral load in your nose, in your mouth, like you're saying. So you're not going to spread it very much. In this Delta variant, it's 1,000 times higher viral load than with the Alpha strain.
So Erin is spreading a lot more when she coughs, theoretically.
Wow. So so we do want people to take it seriously and just wear your mask. Nobody's asking you to wear it all the time if you're vaccinated, but if you're in a large group of people, like you're going to Walmart and on a Saturday when it's packed and you can't social distance, if you can social distance and keep yourself away, then you be good.
Can I ask her my big question now, or do you want to save that for the second
Go ahead.
segment?
I want to talk masks in the second segment because I have a lot of mask questions.
So here is, and this is more of an ethicist's question, but it's something that we have been talking about for a couple of days. And it's when it comes to mandates or more restrictions, whatever it has to be. You've got two groups of people, vaccinated, unvaccinated. Percentages we'll toss out for the purpose of our discussion. You've got vaccinated and unvaccinated. Sure. And we had the mayor on yesterday morning, and he kind of touched it. We kind of talked about it with him, too. And it's basically, as far as mandates go, what responsibility do vaccinated people have to give up their rights and freedoms to protect the unvaccinated who don't want to be protected? In other words, Erin and I, both having been vaccinated, really don't need to be protected from anything. If everybody were vaccinated, we'd never have to wear a mask. Nobody.
If you're not part of that 0.9%.
That's what I'm worried about.
So my question is,
which you don't know.
If if I've been vaccinated and don't need protecting, and the unvaccinated don't want to be protected, why does government have to do anything? Why do anything at all?
So here's my most base answer. My biggest concern is the future development of these variants. We're seeing this virus change, and every person who gets infected is like a little cauldron for this virus to brew in and possibly change. We don't want all of these unvaccinated people. While you may not get sick, you're probably right. By far, the chance of you getting sick is very low. But
the unvaccinated choose to not be vaccinated.
But we could get a variant that we are not protected from by the vaccine.
So what's the plan? What's the answer?
So that's my biggest fear, right? I don't want a deadly, easily spread vaccine resistant strain.
But there's virtually no case that you could make that is going to get a whole lot of people vaccinated. You follow me on that?
No, I agree. I think, there is personal responsibility. And I think when we came down with the alpha strain and we said, it's on you now, right? We're going to be able to take off our masks, but guess what? They all took off their masks.
So back to my initial question. What of her rights and freedoms should Erin have to give up to protect somebody who under no circumstances will never be vaccinated?
So because she wants to protect herself.
Yeah.
She wants to protect you. So I understand I don't want to wear a mask. I hate wearing a mask. But if I wear it only on those occasions where I'm going to be around a large group of people where I don't know their vaccination status, or perhaps I don't know if I'm sick, I don't want to spread anything. If I just do that one thing, we can go a long way for protecting us.
So in your mind, a mask, not necessarily mandate, but voluntary mask wearing would go a long way.
To do it voluntarily. By far, I want us to do it
in your mind,
by choice.
Voluntary mask wearing would go a long, with about 4 O's, long way in stopping the spread of the Delta variant.
I think you're still going to see people who are unvaccinated get sick. We want to do as much as we can. If we put them in masks, if we have them wearing masks like they're supposed to be, they all quit, right? When he said no more mask mandate, what the CDC said was if you're vaccinated, you can take off your mask. Or if you're outside, everybody took off their mask. 2 out of every 3 people in this area are not vaccinated. So 2 out of every 3 people should be having their mask on. So if they put their mask on and we put our mask on only when we're around a large group of people, yes, it will go a long way.
When we come back, can we talk about schools and masks? There's a lot about that people are having a lot of questions about. Everybody wants to know about schools. The CDC is saying masks probably needed at schools. The president is saying it. Our state superintendent says we're going to leave it up to the school districts. What is the advice of the head of the Office of Public Health for our region?
So, the American Academy of Pediatrics came out and said it should be required. They feel like for children, for school-age children, they should, because most of them don't have the ability or won't, and I won't get vaccinated. Their parents won't get them vaccinated. So as far, it's awful hard to put that on a district. It was a lot easy for the districts to fall in line with that last year and keep our kids safe. We had an amazingly safe school year last year with our districts doing the masking and the social distancing and monitoring their kids. We really did amazingly well, had very few in-school infections, outbreaks.
So you would encourage the school districts to put it in place for those above 2nd grade, correct?
Right. And if we are on this path, if we can't bring this back down to a more reasonable level where we're just seeing sporadic cases, if we are in this surge, yes.
We've heard a lot of times it says your mask protects me and my mask protects you. But my mask can also give me protection too, correct?
Right. So all these studies that people point to and say masks don't work. So masks are not 100%. If I wear my mask, I'm protected about 60%. If you wear your mask, then we raise that up to about 80% protection. If we also add distance in between there, now we're well up into the 90% protection. So the two of us wearing our mask and at least keeping 3 feet, we prefer 6. The more distance, the better, of course. But a minimum of 3 feet now, CDC is saying, then we are protecting each other.
Shreveport Security Systems message board via the app. Masks still don't do anything. Look up the Cleveland Clinic study. Follow the science. Fearmonger.
That is the science. I just told you the science. Whoever that is correct that they are not 100% protective to you or to anyone else if it's just one of us wearing it.
Shreveport Security Systems message board. So there could be a new variant that is resistant to the to treatment. Well, the world could end tomorrow, but I'm not living in fear of that. I did my part. I was vaccinated, but I will never wear a mask again. When the CDC said we needed to wear masks, a mandate was instituted. Now that the CDC says we don't need masks, they still want to make us wear them. What happened to following CDC guidelines? You can't have it both ways.
No, you're correct. CDC needs to, what we have asked in the state of Louisiana and multiple states who are seeing low vaccination rates is for them to now put out guidelines for those specific states. So it's hard for them. It's not correct for people in Maine who are 78, 80% vaccinated to have to follow the same guidelines as people in Louisiana who are 30%, 35%.
Shreveport Security Systems message board. Her logic on everyone as an incubator. You're going to have to translate this. For a variant is true but overblown. No one has said vaccinated people don't get the virus, so they are incubators also. You know what that means? I mean,
but you're not spreading it.
Additionally, but the logic that we should stay home and be worried about every communicable disease,
Who said stay home?
Now that's overblown.
Yes.
All I said was if you are vaccinated and you are going to be in a crowd, to protect yourself and to protect other people, wear your mask. There's no one telling you to stay home. I want to prevent us from going to mandates where we're required to wear masks all the time, where we're closing stores. Nobody wants to see any of those mandates come back where we were a year ago, right? Mm-hmm. We want to keep moving forward.
New variants. I saw something today about a Lambda variant in Peru. What do we know about it yet? So it's eventually they all come here, right?
Correct. Well, I mean, there is a Brazilian variant that has been kind of brewing around down in Brazil, which is very concerning. It actually causes stillbirths and maternal deaths. Now, we are lucky. We haven't seen that in Louisiana, thank goodness. Now, it was concerning to me when I saw this baby born with COVID. So that baby and their mother are being sequenced just to make sure it's not that Brazil. We don't want, if that's the case, we want to make sure that we're aware and we're doing everything we can to limit that spread.
Shreveport Security Systems message board via the app. What's being lost is risk tolerance. It seems that Dr. Whyte and others are aiming for zero risk.
No.
That's not possible. I know getting sick sucks, but a kid's chances of getting seriously ill or dying from COVID is lower than most daily activities like riding in a car.
So the problem with this virus is that nobody's been exposed. The problem with this virus, until it first started coming around with the alpha strain. Now we're getting new strains, and we're concerned about our response to these new strains. The problem with looking at these percentages is I can't tell you whether that child's going to do well. We do have children die. It's not many of them, but if it's your child, that's 100%. You're going to be forever changed. I'm not asking for no risk. If I was saying no risk, then I would say nobody leave their house, everybody wear a mask if they have to go anywhere. I'm saying let's just be smart. It's a piece of cloth that you're putting over your face for the 10 minutes you run into Walmart. Nobody's asking you to give up your freedoms, but we're asking you to consider other people and not just yourself.
Dr. Whyte, what do you say to those who are anti-vaxxers with regard to these vaccines and say they're harmful and they're doing damage. What is your message to them today?
So there is a group that is putting out that there have been numerous deaths from these vaccines. There is a system called VAERS, Vaccine Adverse Response System, Adverse Effects Response. And anything can be put into VAERS. So if I get my shot, I walk out, I get hit by a car, someone could report that into VAERS. If I have a heart attack after I get my shot, someone could report that into VAERS. Every single one of those cases has to be researched. That means someone from CDC will discuss with that doctor, with that person, about what exactly happened. We have had zero deaths in the state of Louisiana from this vaccine. That number that they're putting out is just not true.
Shreveport Security Systems message board, last one, I promise. Regarding the vaccine, I'm not taking it, nor will I, until the FDA completely proofs it. In the meantime, I'm not wearing a face diaper either. If businesses require it, I'll go elsewhere, et cetera, et cetera. I mean, I had said to you, we both know people who perhaps not as adamant or as is this text, but they're just not going to get it.
And that nobody, I absolutely don't advocate any mandated vaccinations, and absolutely I don't believe the government would even consider a mandate, or most businesses, until it is fully approved. It's under emergency use authorization. Now, let's be clear. Those studies have already been done. We know that for drugs to be approved, for vaccines to be approved, it takes months, even years sometimes, but the studies have already been done.
Pardon me, because I'm sure one of the major, we see it all the time, I hear it all the time.
Sure.
And I'm sure one of the, same for you, what you hear all the time is, well, it's not really FDA approved. It really hasn't been through all the processes or protocols. Is that right?
So it's been through all the studies, all the animal trials, all the human trials, all of the studies. What we're doing right now is for 5 to 12-year-olds doing those studies. So when those studies are complete, they'll request an emergency use authorization, because from all those studies being finished to full FDA approval takes a very long time. And so that emergency use, we saw it with when anthrax was around and they were talking about medications, and there have been emergency use authorizations in the past. This is not a new thing. It's been through all the studies. No more, it's not that they're, of course they're monitoring everybody. If they've been in these trials, they're still being monitored. That data is still being collected, because the question of boosters, for example, when is our immune system, that protection, waning from vaccines? So that's what they're looking at now.
Got time for one more.
One more thing, Dr. Whyte. I'm going to put my head in my hands.
And then we'll get you a scotch.
Yeah, please. Tequila would be better. When and what is it going to take for this to all be done and you to never be a guest on our show again? Not that we don't like you.
At least for this.
Right.
So we were close, right? We were seeing only sporadic cases. We were moving forward. We were all going on vacation and seeing our friends and all these things. The problem came when people who refused to vaccinate also refused to protect other people. So everybody wants to scream, my rights, and I absolutely agree with you. You have your rights. But when your rights infringe on other people's rights, especially their health and safety, then you gotta take the most minimal steps on those rights as you can. I prefer for it to just be, hey, this is the right thing to do, wear your mask in this situation. Other than that, go do your thing. But if people aren't willing to do that, we've seen it. We know exactly what to do. We've done it 3 other times where we brought ourselves out of these surges, where we social distance, we stay home if we're sick, we wear our mask if we're in large groups. We've done it. The biggest thing right now is people don't want to get vaccinated. For that person, I honestly don't care if you get vaccinated. If you choose not to get vaccinated, that's on you. You're taking the consequences. Yes, the chance of you getting very ill is low, but there are people like my husband and other people who almost died or did die, and they didn't think their chance was high. We all thought our chance was low. Every single one of us thought, oh, it's low. Mm-hmm. But 610,000 people have died. 610,000 people who thought their chance was low.
Real quick, if you have convinced one person today to get vaccinated, where do they go? What do they do? What's the best place?
So there is a site called vaccinelocator.com is the easiest one. And you just put in your zip code and it'll tell you available sites. The LSU is always at Chevyland, 10 to 6, Monday through Friday. They will also test. Testing is also important. We haven't really touched on that, but if you are not feeling well, it's important to get tested. Of course, nobody wants to do that because they don't want to consider quarantining, but it is important because that's another way we're going to get on top of this is to limit.
Here's one that's making her go crazy. So reporting to VARS is like they reported COVID deaths. He was hit by a car and happened to have COVID, so his death is a COVID death.
Absolutely not. So there may be some cases where someone died of something else and also had COVID. Every one of those cases where someone is they're considering calling it a COVID death comes through the Regional Office of Public Health in each region. So for all my 9 parishes, they all come to my team. We have to literally read the entire chart. We have to look at all the labs. We have to look at their history, and we help determine whether those are legitimate COVID deaths. We are not counting someone who walked across the street and got hit by a car as a COVID death.
And then tested positive.
Right.
Okay.
You have to have had a concern through all this, though, that the CDC will say one thing, the World Health Organization will say one thing, Dr. Fauci will say one thing. So people are frustrated, and that has been a mess with this.
It has been. It has been. And so that's why the state of Louisiana has tried to stay with CDC recommendations. The information Robert brought up about how they've made these recommendations about not masking, we are requesting that they look at our situation now for where we are. And if they come back and say, we don't think you should mask, then, I imagine the state of Louisiana is going to come out and follow CDC. That's what we've done from day one.
One more time, the vaccine to get it. Where's that site again that's the best place to go?
Vaccinelocator.com is an easy one. You just put in your zip code and it'll show you sites. You can always go on the LDH website, and you can always go to Dr. V over in Chevyland on Linwood.
Gotcha.